About 60% of ALK positive patients actually develop brain mets within 3 years of diagnosis. Most will have to stop driving for 12 months, and this can have a very disruptive effect on family life. I'm delighted to introduce, I'm going to try and say your name correctly, Dr. Perez Corelio. Thorelio. I'm not Spanish.
First name is Inigo.
Right.
I-N-I-G-O.
Yes,
Inigo.
it's
That's
not
easy.
indigo.
You can call me Inigo. No, Indigo.
As I wrote to him.
No, D.
He said, oh, thank you, Indigo, for agreeing to come to speak to us. So, anyway, I apologise profusely afterwards. But I am delighted so that we do have someone from the DVLA to actually discuss how decisions are made around the rulings. So I'm going to hand over to you. Thank you very much.
Thank you so much. Thank you for the invitation. Thank you, gentlemen, for showing me out. Thank you. Now, I am Spanish, and apparently, I have a strong accent. So if you don't understand me, let me know. Word, concept, let me know. We will repeat it, okay? I'm not going to talk about fitness to drive from the point of view of brain metastasis. Most of you will know the standards. Lung cancer does not need to be reported to DVLA, but brain metastasis too. What I'm going to talk is about more insight into fitness to drive. Where do responsibilities, law, and so on comes from? So that's the outline. Again, insight into fitness to drive. Law, DVLA. Drivers Medical Group is the section of DVLA dealing with fitness to drive. Medical advisory panels. Briefly, I'm going to mention brain metastasis and driving. Section 88 of the Road Traffic Act is very important. Many clinicians don't know about Section 88. I suspect most of you do. Does anyone here have any issues or doubts about Section 88? Because if you know all about Section 88, we could give it a miss. I think it's very important. Questions and answers. With the blessing of the chair, I'm happy to take questions as we go because I think they are more relevant in that moment. The DVLA, the Driver and Vehicle Licensing Agency, has many responsibilities. One is to keep records of drivers, vehicles, the medical problems. We actually collect £7 billion in car tax, and we have, as you can see, 42 million driving licenses and records for cars. We also help the police to fight crime and so on. And it's Drivers Medical Group, the small section with the DVLA, the ones that has the responsibility to ensure all drivers are fit to drive. We are doing that on behalf of the Secretary of State for Transport. So we could say that our aim is to promote road safety, that's the driver or the drivers and the pedestrians, by applying medical standards of fitness to drive and legislation. I put that in red because that's very important. DVLA is not the enemy to fight, okay? Sometimes you may think we are not. What are the bases for the legal basis for the medical standards? Two pieces of legislation, the Road Traffic Act, 1988, and the Motor Vehicles Driving Licenses, 1999. As I said already, DVLA, acting on behalf of the Secretary of State for Transport, has the responsibility to ensure all drivers are fit to drive. You are not patients for us. For us, you are license holders, you have a license, or you are applying for a license. So for us, I'm going to use the term drivers. So license holders, applicants who have a significant medical condition have a legal obligation to report that to the DVLA. We're talking about someone with pneumonia or broken leg, but we're talking about significant conditions. Epilepsy, insulin-treated diabetes, significant traumatic brain injuries, dementia, and so on. Legal obligation. Doctors or healthcare professionals do not have any legal obligation. They may have a moral obligation if the person is at risk and the person refuses to inform the DVLA. but that goes with them. The law gives us powers to investigate on good grounds, and we come across malicious notifications. You can see sometimes in the tone. I always think that anonymous notifications are very rude, and I read once a cartoon that says, anonymous notifications are very rude, so I always use the name of my neighbor. But actually, I do. But sometimes you can say, this man is 90, he's demented. Calm down. And then we start looking, perhaps they have had some problem with the neighbors. So my ex-wife or my ex-husband, they're always drinking and driving. Okay, what do we do? So sometimes we need to start investigating. We need to have some good grounds. And then we can grant a license, more often than not. Does anyone would like to guess how many out of the millions of cases we see come out with a license? Someone give me a number, out of, in percentage. 50%, 25%, 91 or 92%, okay? So when we look at all those cases, it's 10% or less of people who are actually unfit to drive because they don't meet the standards. We can also restrict licenses in duration, 1, 2, 3, 5 years, or perhaps to an automatic vehicle, hand controls, and so on. And then the drivers can appeal. When they don't like what we have done, you can appeal. Anyone from Scotland here? In Scotland, you only have 3 weeks because you have some old laws, but in England and Wales, it's actually 6 months. You can appeal to the local magistrates. These pen pushers took my license, but you better take medical evidence to support your appeal, okay? The first point of contact should always be us. Sometimes we get it wrong. Perhaps even you have the support of the consultant. Write to us, okay? But you can, if you appeal, we go to the court and we explain why that particular individual does not meet the standards of fitness to drive. I'm not trying to discourage you, but more often than not, the appeals are dismissed. So we are giving the reason. But I insist, when you have a case, fight for it, because sometimes we may get the information wrong. What are the medical standards of fitness to drive? I remember years ago, it was a Group 2 driver, that's a lorry or bus, who had had a heart attack, and he had to go for an exercise test, walk on the treadmill to see if his heart was okay. He failed the test, and we said, you can have a license. And he wrote, a bunch of GPs making these standards on a Friday afternoon in a pub. No, it's not like that. We have panels of very eminent doctors. Some of them are, my God, okay? So the interpretation and application of the law from panels of experts, okay? Few medical standards, and this is important, are down in law. Epilepsy, vision, insulin-treated diabetes. If you don't satisfy the law, you cannot have a license. Duralex, Sedlex, the law is harsh, but it's the law. No argument there. However, most of the medical standards are advice from panels, okay? Very often based on medical evidence, sometimes based on experience. This could be challenged. And the standards are in the guide Assessing Fitness to Drive, a guide for medical professionals. It's actually written in plain English, so if you go to gov.uk and you put a search for assessing, you come across this. It was published, the latest edition was published yesterday. We were promised months ago, but it was published yesterday. So what about the medical advisory panels? Who are these? We have 6. For brain metastasis, obviously, the most important one is neurology. We have had very eminent neuro-oncologists in the panel. We have had Professor Braddock, who is now in Liverpool, Professor Short, who is in Leeds. Currently, we have a neurologist with a special interest in neuro-oncology. And yes, we have eminent doctors in their fields. And the last thing is very important. Well, the panel is advising on the medical standards. The last one, these are advisory panels. They don't have any legal powers. So, for example, the law says if you have an epileptic attack, you have to stop driving for 6 months or 12 months. So I couldn't give a license to someone after 3 months because the law says it's 6 or 12, depending on the conditions, okay? Advice from panels is advice that can be challenged. And not encourage you all to challenge every single decision, but those things can be challenged. They are not in law. The law, for example, says that we must see a number plate at 20 meters. Okay, so the best driver in this country, if he or she cannot see a number plate at 20 meters, by law cannot have a driving license. There is no way around that. That's law. But more often, the standards are advice from panels. I'm here giving a lecture today. Great pleasure, privilege to be here. But my day-to-day job is to deal with medical cases, okay? So I have to assess fitness to drive or disability by applying the medical standards of fitness to drive, advised by law or the panel. And my area of expertise, therefore, is the interpretation and application of the standards of fitness to drive, okay? As in legislation and panels. I don't have a responsibility and I don't have the authority as a DVLA doctor to justify the standards. That's up to panel. Panel advises on the standards and we apply those standards. Obviously, when there is something is wrong or we are coming across problems or unclear, confusion, we raise those issues and panel revisits this. A little example, it has been keeping me awake several nights. Panel advice that brain metastasis, when there is only one, a solitary deposit, what we call in the posterior fossa, which is the lower back part of the brain, after treatment, those drivers could drive. Why is that? Because when you have a lesion in the lower back part of the brain, you don't have a risk of having epileptic attacks, okay? So everyone very happy about that. But then I was given, I insist, it was published yesterday, and I was told it was going to say a small solitary metastasis. My first question is, what is a small? You need to define if you are going to put that. Well, I'm very pleased. This morning, I checked, came out yesterday, it doesn't say small. So we raise those issues, and then panel will have to address and answer. So far, so good? Yeah? I don't know if that can be seen well, because you come across sometimes with these fancy slides. And this is the way we assess fitness to drive, okay? The process. The first thing, as I said, the driver has the legal obligation, and actually more than 90% of the notifications come from the drivers. Sometimes we heard third-party notifications, family notifications, police notifications, consultants notifications, and so on. So you provide a self-declaration, and depending how much information is provided there, a licensing decision can be made up, because we apply the standards. You are looking with a puzzling face. No. If I have someone, for example, telling me, I fell off my horse, I banged my head, I had anesthesia, I was taken to hospital, and I had a brain contusion, I know that person cannot drive for 6 months. I don't need any other information. So I can apply the standards there, okay? Because I'm going to encourage you, when you notify to DVLA, I said this already 16 years ago at DVLA, I said, for us, the best driver is the one that comes with all the information. So when you apply, for example, to notify DVLA you have a problem, or you apply to regain a driving license, ask your consultant, ask your lung cancer to give you a recent letter of support, and that's going to speed up things. It's going to be very helpful, because that is what we want, okay? So depending how good is the information, a licensing decision can be made at that time, okay? If we don't get enough information, then we ask your consultant, or the law has changed, thanks God, the law, very old Road Traffic Act 1980, it was all doctors, changed 3 years ago. Now we can get reports also from nurses and so on, okay? So then we go there, and if all the information is provided, then, you see, we can say, okay, apply the standards, they meet the standards or not, they can have a license or not, and so on, okay? Keeps going like that. I insist there, it's always helpful to provide some information. If you can get that information, and I can see how these days patients get a lot of information, and good for that, send it to DVLA. All that is going to be helpful. Okay, any questions about this? So in the end, a licensing decision is made. I'm reading there now the CRAN 3. We go the CRAN 3 or any report. Any letter is going to be helpful. We are only 40+ doctors. We have a lot of clerical staff, and these people are not medically qualified. They follow operating instructions. I take my hat off because I couldn't follow operating instructions. I find it extremely complex. And sometimes we have information with a letter, and the letter is so rich, gives you all the information. So, Dr. Perez, do we need a CRAN 3? You don't need anything. All the information is there. I said I was going to mention this briefly. Lung cancer doesn't need to be notified to DVLA. Brain metastasis from any cancer must be notified to DVLA. More or less, this is the standards. May drive, but must notify DVLA. And asymptomatic, no symptoms, brain metastasis, typically identified on interval imaging scanning. The clinical decision is, I think, is very unlikely, but it could be like, just a second. They are very tiny. Let's not do anything. Let's repeat the scan in 3 months. If that is the case, no treatment for the brain metastasis, then that person can drive. However, if the scan shows that the brain metastasis is growing, and you would expect that the natural evolution of a brain metastasis untreated should be to grow, they will have to stop. The other thing is, patients who are already on primary treatment for their lung cancer in this case, so someone already on targeted therapy, and they are found to have 1, 2, or 3 brain metastases, if there is no change to the treatment, then that person can continue to drive until the next scan. The next scan, and this is new in the standards, it will depend if the new scan shows progression or a new treatment. So I'll give you an example. Someone is on targeted therapy. They are found to have a brain metastasis. Treatment does not change, can drive. 3 months later, the brain scan shows that the metastasis actually is smaller, and the patient has developed significant anemia. So target therapy A is changed for target therapy B. That person can drive because the change to the treatment has not been because of the brain metastasis, but because of side effects of the medication. Are you clear? A different case will be the same case. They repeat the scan. The metastasis has grown, and the consultant says, I tell you what, let's give a bit of SRS, stereotactic radiosurgery, so then the person will have to stop. Or the targeted A is changed for targeted B because of the brain metastasis. Is that okay? Is that clear? Any questions about this? Yeah. The answer is in the next slide. Sorry, this gentleman is asking if I have SRS or someone has SRS, how long you have to stop for? 1 year. So a specific treatment for a brain metastasis from any cancer, okay, a specific, what is called sometimes, talking about papers, local treatment, so surgery or radiotherapy, 12 months, provided that it gets better. There is improvement or stability. Certainly it doesn't get worse, okay? If one problem we have, and we are trying to sort out, is that if someone, for example, is diagnosed with lung cancer, brain metastasis, and they are asymptomatic, I insist, from the brain metastasis point of view, but they are started on targeted therapy and nothing else, they have to stop driving for 12 months, okay? And we are still in discussions with panel if perhaps something could be done about that. And I know you are also in discussions with DVLA and panel, okay? Basically, that was the question for the gentleman. If it's changed, no, sorry, this is the next one. If it's changed because of the brain metastasis, you will have to stop driving for 12 months. And then symptomatic or asymptomatic brain metastasis, when they have the local treatment, has to stop for 1 year. I didn't put the times because I just wanted to make the differentiation between one and the other. The only case that requires 2 years of driving is whole brain radiotherapy, which these days is hardly used. Now, this goes towards your challenge when you are challenging DVLA, and I encourage you to do it. Assessing fitness to drive, and I insist, the last one was published yesterday. When it's talking about brain tumors, including brain metastasis, says the risk refers to anesthesia risk and or risk of recurrence and risk of deterioration. In other words, so no response to treatment, okay? So are there exceptional cases? There are always exceptional cases, unless the law says, because then there are no exceptions. I'm Spanish. In Spain, we have an extra gene to go around the law, but we do. I'm not proud, I'm just telling you. But in this case, no. The law says you cannot drive, okay? So if a clinician provides evidence that the particular case is different, exceptional case, exceptional means rare, unusual. And if legislation allows, we, DVLA, have the ability to afford individual consideration. More often than not, that case goes to panel and they come out with the goods, okay? So that clinician, for me, should address the issue of risk of anesthesia, risk of deterioration, and risk of recurrence. Sometimes for some of the conditions, we receive very subjective reports, some with a big, severe traumatic brain injury, a big head injury, damage to the brain, and the risk for group 2 drivers has to be less than 2% per year. That's very difficult to calculate. Fortunately, we have a study now has created amazing tables for us, and we are going to have new standards about that. But last year, I had a report from, no doubt, a very eminent professor of neurosurgery, expert in head injuries, who said not that the risk of anesthesia was below 2%, but it was 1%. Wow. So I can write polite letters, and I wrote to him to say, okay, do you have any medical evidence to support that? I'm still waiting. Probably he was very busy, but there was not at that time any medical evidence to support that statement, okay? And now we have received, as I said, tables from a Swedish study made for us, and actually new standards are going to come out. So the clinician supporting a case has to provide some medical evidence.
Give you an example. If a person 7 years ago was detected with brain metastases for the first time, and that detection showed one tumour at 28 millimetre, another tumour at 22 millimetre, and various spots, that person has to stop driving, no question. But after 4 months of a change of treatment, those spots have disappeared. The two main tumours have shrunk by 60%.
So there is response to treatment.
Yeah, and the basis has to also accept that if you've got tumours like that at detection, they've been there for a long time. And you've been driving, you're asymptomatic, you're going forward, and the treatment is working. 4.5 years later, you have a very slight progression, which needs to be treated by a change in TKI. But at that time, those tumours are still, there were 28 millimetre and 18 millimetre, are down now to 16 and 6. And that person is still asymptomatic. Going forward, it changes to another TKI.
But he's receiving a specific treatment, systemic treatment for the brain metastasis. That's what they are saying, yeah.
Yes, yes.
I'm not justifying...
And again, those tumours then reduce again,
Yeah.
And the patient is still asymptomatic.
Yeah.
What is that 20% risk? I understand the risk is 20%.
I don't know how to
Yeah.
calculate the 20% risk. I'm telling you how you could challenge that. And a couple of observations. As I said before, I'm not defensive. Okay, I'm not defensive. But my role at DVLA is not justify the standards. I may agree or disagree with some of them. Okay? But you said, for example, 7 years ago. Well, 7 years ago, you would have to stop driving for 2 years. Because those were the standards.
Mm-hmm. Yes, yeah.
Okay? And now for what you have said, there is a new metastasis which is treated specifically with targeted therapy. The current standard is I have to stop driving for 12 months. I may agree or disagree, but I'm telling you the standard. And I'm telling you how you could probably challenge that with the support of a clinician, addressing the issues of station risk, risk of recurrence, and risk of deterioration. You put a very convincing argument there. After 4 months, things are getting better and you are not having stations. Mm-hmm. I'm not saying I don't want to listen. No, what I'm saying is I'm the messenger here. I cannot do anything for that. My role, I explained already what it is to apply the standards. And when there is a difficulty, to identify and raise the issue. And I can assure I do that regularly.
Well, I think this ability to challenge that decision and present information is something very recent, because I recall letters to me 7 years ago telling me, oh, and by the way, you can challenge this if you don't like it in the courts.
Well,
and that is a very kind of...
Yeah. I hope I didn't write that letter.
No.
And yes, I cannot, not justifying again, I'm embarrassed to admit that that could happen. And I could tell you 1 or 2 stories very close to me, completely unacceptable, okay? And I wish you had actually, written a formal letter saying this is not on, this is bullying people and so on. But that's a different story, okay? Okay. This is very important. Is everyone aware of the famous Section 88 of the Road Traffic Act? Sorry, when I'm not there, can you hear me? Yeah. Is everyone aware? Is someone who is not aware? I know, but I'm going to raise my hand, so not everyone does. Now, the law is very particular, and the law is gracious to people who play ball with the system, okay? So, for example, I don't think I mentioned that before. I missed that, actually. Someone is told, you don't meet the standards. With my knowledge, working for DVLA, 24.5 years, and I'm very lucky, I love it. My knowledge of the system, if I had a problem, I will surrender my license. Boom. I don't meet the standards, I cannot drive, I surrender my license. Why is that important? Because if you surrender your license, if you have a problem and you don't meet the standards, you should advise to do that. From the point of view of the DVLA, it's perfect. You surrender your license, we don't need to do anything. Case is open and closed, you cannot drive. Now, by law, once you meet the standards, you could start driving on the anniversary of the period of driving. Let me give you an example. A lady, this is a case I had 2 days ago, had radiosurgery for a brain metastasis, was from breast cancer. The same day, she had 2 epileptic attacks, provoked seizures, we call them, because there was swelling in the brain. She surrendered the license to the DVLA. Following scans, things were getting better, and she had a scan as recent as June saying that metastasis had actually disappeared. So then that lady, that driver, applied to regain the driving license. DVLA has to receive the application. Quick phone call, have you received my application? Yes. And by law, that driver could start driving 1 year after the treatment and the provoked seizures, by law. So it's not for the DVLA to decide or someone else, by law. And you don't need the blessing of the DVLA. So it's important clinicians also know this, okay? But the license must have been surrendered. If your license has been taken away by the DVLA, Section 88 does not apply. Unfortunately, if your license has been revoked is withdrawn by the DVLA, an existing license, and then you apply to regain your license, and you can apply a couple of months in advance. We always say 8 weeks. Why don't we say 2 months? From the time you send the letter, it gets to DVLA 8 weeks. 2 months in advance, you can apply. Okay? But if your license has been revoked, even if you meet the standards, you need to wait until the DVLA grants you a license. If the DVLA building burns or we are overworked and there is a delay of 3, 4, 5 months, shame on us, but you cannot drive. So if you don't meet the standards, and I would do that, I will surrender my license straight away. Okay? Any questions about this? It's very important, okay? So,
If you're driving under Section 88, I had problems with like insurance, because when I got in touch with my insurance, they'd never heard of Section 88.
no, well, they need to get that act together because
But I phoned quite a few.
I said it very firmly. This is law. So you
even on
cannot
the-
be waiting at home for the DVLA to send you the letter. By law, the example I use, that person could start driving 1 year after that, by law.
So, because I even on like the compare the market, all of those never ask about Section
Yeah.
88. So, do you need to tell your insurance company that you're
I
driving
work
under
for
that?
the DVLA. Do we have someone working for insurance companies here? When I came to this country, okay, I applied for a driving license, and I completed everything. I got some quotations, and I remember, they say £400 and this and that. And because I was not born yesterday, I phoned them and I said, oh, by the way, I used to have epilepsy many years ago. Oh my God, we cannot insure you. And another one said, did we say 400? 800. So don't start me on insurance companies, please. Nothing to do with me. That is the law. And also very important is when you are renewing a driving license, because you have your guidelines or leaflet about brain metastasis, and if you have to stop driving, normally it's for a year, and then when you come, we give you a license for a year, and again for a year, and for a year, to be sure that there is no relapse or anything, okay? So Section 88 will also apply on those cases. So a person has to stop driving for 12 months, then they get their driving license, and they apply 1 year later to renew a valid driving license. Section 88 applies straight away. Okay? The only issue you may have with an insurance, but again, I wash my hands, nothing to do with me, is if perhaps you don't have a document. Ask the DVLA to provide you with a document. You are taking a long time to give me my license. Send me a letter saying Section 88. They will not be able to tell you that you meet the standards for Section 88, but they will tell you that potentially you do. Could be something else hidden that we don't know, okay? I cannot hear you very well, sorry. Yeah, but I insist, this is a very interesting, a very interesting piece of legislation. It's important to know. I told you already, I used to have epilepsy. I don't hide it, okay? My last epileptic attack, hundreds of years ago, was a sleep attack, and the law gives concessions for sleep attacks or awake attacks. So if tonight, tomorrow, next day, I were to have a sleep attack, actually I don't lose the license because it's again another sleep attack. But if I were to have an awake attack, I lose my license for 12 months straight away. So the first thing I will do is stop driving. I will surrender the license to the DVLA. And I work for the DVLA, so I could put my letter without the stamp. We are done here, okay? So normally I put 7 take-home messages or 20. Sorry, there was a question there?
Sorry, I just had a question about
Please.
the 8 weeks you were talking about while you were on it. I was just wondering, say I could apply now for the deadline, you know, the date that's a year in 8 weeks. Would it matter if I had a scan expected in the interim? Would I apply assuming that that scan would be clear and then let them know if it isn't?
You will know that, or you will have to know that. In the example I use, this was a lady, and this is a real case, I had it. So this lady had, I was on the 30th of June, okay, that she had the treatment, anesthesia, and she surrendered the license, that was it. Then she carried on for the next 9, 10 months, everything was getting well, and a scan, I think was in April, showed clear. So she sent the application to the DVLA, she checked, because we need to reset the application. I know we are unnecessarily bureaucratic, but some people say, oh, I sent the application, okay, we have not received it. And the law says we have to receive it. And it has to be correct. You have to sign here and there, so it has to be, okay? So in that particular case, the lady applied for her license. The brain scan was better. She was much better, and it was going to be 1 year. So I insist. On the 30th of June, by law, that lady could start driving because she had surrendered her license. When you apply to regain your driving license, have you surrendered? I'm maybe not comfortable because we are discussing your case in front of everyone, but have you surrendered your driving license?
Yes, so I surrendered it a little, well, yeah, let's say a year ago.
Right.
And I would be looking to apply for it again.
Right.
And so it's not necessarily about the Section 88, but it's more about this 8 weeks you can apply ahead of time, and whether if you're expecting a scan result in the meantime, is it still worth applying ahead of that date?
You can. But I think
assuming that will be clear because your previous ones
but the latest one probably was already better. You see, because we are always looking for no deterioration. As a matter of fact, very often we say stable or improvement. And in that particular case, I keep repeating, the brain metastasis had gone, had disappeared. So if you already have brain scans showing that those metastases are stable or getting better, apply 2 months. Forget about the 8 weeks. 8 weeks, I don't always say that. 2 months, so easy. Send that information. Okay, you will have to complete some forms, and you can say, yes, I had this treatment, I'm well. Nothing with sending a covering letter to say I'm well, this and that. Brain scans have been showing improvement and all that.
Brilliant, thank you.
Okay, no problem.
Thank you. I applied to renew my license because, you know, they send it to you for a year.
Yeah, I do.
And I applied and they received the evidence from my oncologist in February this year.
Yeah.
But they still haven't given me my license. So I'm just wondering whether there's a deadline for that. Or
No, you are driving under you could
Yes, I
drive
am.
under Section 88.
I am driving
Yeah.
under Section 88.
Obviously, when did you apply to renew a valid driving license?
It was from about January.
Wow.
Yeah.
That's embarrassing, isn't
Yeah.
it? I think you need to put some pressure there.
Yeah.
Yeah.
And the last time I chased it was April, but
Yeah.
they just said that I could look into Section 88.
Yeah, but that's very easy because based on the information you have provided, it should be almost automatic, the renewal, okay? I'm very critical with my own organization because I'm conscious that sometimes we do things in a bit bureaucratic, unnecessarily bureaucratic. I think I used that word before. Put some pressure there, yeah, okay?
So what would you advise would be the next step for me to do? Do I just wait
When there, to Swansea?
for them to issue my license?
I think you need to put pressure. I don't know if the right way is to do it by in a letter or phoning them, but you need to put some pressure, okay?
Thank you.
My question is, why do we have to surrender our licence straight away when we're diagnosed with lung cancer, when we're not told we're terminal?
I did not say that you have to surrender your license when you are diagnosed. I said, if you are told you don't meet the standards of fitness to drive, you should surrender your license. If you don't want to do it, It's up to you.
You know, my licence was revoked.
Yeah.
I was a lorry driver at the time. This was in 2021, in the middle of the COVID pandemic, when there was a shortage of 100,000 lorry drivers on the road at the time.
Yeah.
And yet they took my licence off me.
And sorry, your license obviously was taken away because you did not meet the standards.
There was nothing wrong with me. I mean,
If there was nothing wrong with you, and I'm not here to fight, not at all.
Yeah.
If there was nothing wrong with you, then I cannot understand why the license was taken away.
I've had no symptoms. I've had,
Sorry, with all due respect, did you have a brain metastasis?
yeah, I've had a brain
Right.
metastasis.
The new standards, I don't mean to interrupt you, I don't mean to be rude at all, but the new standards, considering observation, okay, came out in January, so was that now 20 months ago, January last year. When you were taking away your Group 2 entitlement, at that time, Group 2 drivers with brain metastasis, no, that was a permanent bar. We have moved from there, and now I think more often it goes towards the 5 years. Did you eventually have any treatment for your?
Yeah, I'm having tablet chemotherapy at the moment.
Right. So the standards have been, I know, because you were a Group 2 driver, that may sound like nothing, but at that time was a permanent bar. And now they're going down towards 5 years for Group 2 drivers when they have had treatment for their brain metastasis.
Yeah,
but at that time, 2021, anyone with a microscopic brain metastasis, I'm not saying it was right, I'm saying they were the standards. And car driving, also a car driver also will have to stop.
Yeah, but it's a blanket right across the field. There's no individual.
It was a blanket, yeah, it was a blanket.
Yeah, but you should treat each case as individuals.
Yeah.
Because, like I say, there's been nothing wrong with me. I'm probably fitter than 10% of your work staff.
Yeah. The problem for what you are saying, the problem was you had a brain metastasis. And then the standards, the view of the standards at that time is that a Group 2 driver driving with a brain metastasis was not road safety. I'm trying to explain what happened. And if you are told you don't meet the standards, surrender the license. Surrender the license. Remember those 2 months before, try to get fresh medical evidence that you are getting better, scans are getting better when you apply. That's going to speed up your process. And symptomatic or asymptomatic brain metastasis must always be reported to DVLA. And I don't have room for a fight, but I insist the DVLA is not the enemy to fight. Okay? Thank you so much. Thank you.
It was always going to be an emotive subject because the ramifications of developing a brain met are so enormous to us. And I stand here as someone who developed a brain met, so I have full empathy with everyone. But I would like to,
I do too.
and yes, but I would like to thank our speaker for coming along with what could have been a terrifying ordeal. So thank you for being so nice to him. So as he says, he's mere messenger. And what do they say? Don't shoot the messenger.
Or anyone else.
Yeah, so